Hey, what's up, everybody? Welcome to Trust and Believe. I'm your host, Shaun T, and today we are going to enhance your ability to truly trust and believe in yourself. We have an amazing guest today, and I don't know if you are on TikTok or social media, but what I'm so happy about is the awareness that a lot of people are bringing to ADHD. And what I've learned a lot over the past couple of years when it comes to ADHD, some people, one, didn't know they had it. Two, people were questioning their ability to thrive throughout their day. But Perry Mandanis is going to take us on a journey today to help us trust and believe in ourselves through his story and how he can motivate you become the best you that you can be. Get ready to trust and believe.
Somebody say hell yeah!
What's up? He's better than Oprah. Come on, y'all.
This is Shaun T, and it's time to trust and believe. Okay, Dr. Perry Mandanis is a medical doctor with over 35 years of experience in helping children and adults improve their symptoms of ADHD. Throughout his career, Dr. Mandanis has faced his own personal challenges. Having suffered a spinal cord injury, he became wheelchair dependent and had to reinvent himself to overcome the challenges of his disability. That experience has informed his practice of mental health and helping others to triumph over their challenges. In addition to his work as a doctor, Dr. Mandanis is also the host of the podcast Couch Stories, where he shares inspiring stories of resilience and perseverance with his listeners. Through his platform, he showcases the value of overcoming adversity, demonstrating that sometimes the right story at the right time can change our struggles into amazing gains. I do want to say, Dr. Mandanis, that he did share a story with me that he's a singer. I'm not going to ask him to sing. I'm not going to ask him to sing on the podcast, but I will say we actually share that experience. So I'm really happy to know that we have something in common that I'm assuming you're very passionate about, and so was I. And with that said, I want to tell me about your life. I just find you to be very interesting and your take on life from what I've read. So I just want to start from the beginning and like in some songs they say, "Let me know."
My life really did change radically when I fell down a flight of stairs. And the timing of that was crazy. I had finished, 4 years of college, 4 years of medical school, 7 years of residency, and literally moving my desk into my office before the first day I opened the office. I fell down a flight of stairs, broke my back, and had a spinal cord injury, and did not get to launch my career. So I suddenly found myself in the hospital for one whole year and literally had to reinvent myself. And so, when I think about myself, I'm really good at reinventing myself. That's something I learned how to do and something I share with others because we have to be flexible and adaptable because you never know what's going to happen.
I just want you to maybe inspire people on once they recognize that there needs to be a change or a reinvention of themselves. I think in your case, it was, I need to do this and I have to do this and I need to be inspired to do it. But what about somebody out there that they see that there is a change needed in their lives, but they're very afraid to take that step to create that reinvention?
I wish I could say I have an easy answer to that question, but I don't. In fact, the way I came about it was I had to go through the dark side. I mentioned I
Mm.
was in the hospital for a year. Well, right around the 6 month mark, I began to pay attention to the nurses and I studied when they would come and go from the nursing station. I'm a medical doctor, so I knew exactly what I needed to steal if I decided I wanted to take my own life.
Mm.
And just having that thought was like completely freaked me out. So I mentioned this to my doctor. They realized that I was starting to get depressed and they started me on some medicine. They started me in therapy. And the man that I worked with helped me immensely. And what he said was, I work with people who have had spinal cord injuries. That's all I do. Everybody I meet, Perry, is just like you. And what I learned is they end up in one of two groups. Group one are the people who stay mad, stay angry, stay stuck, and miserable about their spinal cord injury because of all the many things that have changed in their life and all the losses. And group two figure out how to be happy people in wheelchairs.
Hmm.
Well, that statement, happy people in wheelchairs, really messed with me because it meant I had to radically accept that I was going to be in a wheelchair. There was no bargaining, there was no more wishing, there was no more hoping. You know, radically accept this was my new reality. So, for anybody who is experiencing a struggle or a desire for change, sometimes it really starts with just acknowledging that you're struggling and trying your best to switch from problem thinking to solution thinking. Because when you change how you think, you change how you feel. And when you change how you
Hmm.
feel, you change how you behave.
I'm going to give you an amen really quick because that is like so amazing. Because it's such a what I like to call a staircase of events that you can create or
Yeah,
you can take action on to make you behave differently. I think the other thing is reading your bio. We have something very similar. I say, turn your struggles into strengths, and you say turn your struggles into gains. So before, again, I know we want to talk more about ADHD. At least I do a lot, but I just want to know, what did you gain from this, what I like to say, unfortunate experience, but it's fortunate enough that you can inspire people. But what did you gain?
at the risk of sounding arrogant, I'm a damn good therapist. I
Come
think
all the way through.
I
Yes.
really think that my spinal cord injury and what I went through and what I learned helps me to appreciate other people's struggle, not in an
Hmm.
academic way, like a lot of doctors, but in a real, visceral, feel it in your gut kind of way when I hear people's stories of their struggles. I also think it makes me more accessible. People know that I get it because I'm sitting there in a wheelchair. So I think what I gained was more skill, more thought, more empathy, and just became a better therapist.
I think it's okay. I think a lot of times, like I talk about being positively selfish, and people are not wanting to say, I'm really great at that, or I need time to myself. And my kids, I'm going to get a babysitter tonight because I need to be with my husband or whatever. And it gets a negative connotation because other people look down upon either you needing to give yourself something great or you just telling yourself that you're great. And I'm like, why do we always have to wait for someone else to cheer us on? Because we are living in our bodies. And so why can't we look in the mirror and be like, I'm damn good at what I do. So I'm happy you noticed it. I'm happy that people are able to connect with that and you gave them the permission to believe in themselves in that way. Let's talk ADHD
Sure.
because it's easy to watch a TikTok or Instagram reel or even go and Google and see symptoms or see things. But I want to get, ADHD 101 in the way that you want to explain it without me asking any direct questions. So let's just umbrella. I want to give you the floor to talk about ADHD.
So let's start with what is it, right? ADHD is a neurodivergent condition, which basically, is a fancy way of saying people with ADHD's brain developed differently. And it developed differently in a very specific way. Inside of our brain are all these bundles that are like highways, and information travels down those highways. And if those bundles don't develop exactly properly, or they develop differently, or they develop slowly, then that person will have the core symptoms of ADHD, which include inattention, impulsivity, and for some people, hyperactivity. But because it's about four different bundles, not everybody's ADHD is the same. Some people might have more trouble with time management. Other people may have more trouble with motivation. Some people might be inattentive. Other people may have more impulsivity. It really kind of depends on how their brain developed.
Hearing brain develop differently, that's the first time I heard that because I think initially when people think ADHD, they automatically think this person doesn't pay attention or they're hyperactive. And especially when I was a kid in elementary school, when you would hear, a kid had to take medicine because of that, it looked like they just didn't have control, but you didn't hear the science behind it to say, well, this person's brain developed differently. It's kind of similar to just mental health struggles. If we walk into school or walk into work and we're sniffling or we have a fever, people are immediately like, oh my gosh, you're sick. Like you don't feel good. But something which sounds like ADHD or mental health struggles, because it's not tangible to the eyes, people
Right.
just are like, oh, that's just a thing, And so I guess another question I have that's very selfish, which I'm happy to be selfish today, because I have 5-year-old kids and they are completely different. One of my kids is the wildest person in the world, and I love it because I'm wild. And my other child is just literally the most logical thinker. And as a parent, I get nervous with that what I like to call the wild child that's like me. And so I'm always like, do I need to ask the doctor? So like at what age when it comes to ADHD do people usually start to see symptoms or activities? And then, how does it progress as people get older?
Sure. Actually, that's highly variable. I have talked to moms who knew that their baby was hyperactive before the baby was born. These were mothers who'd had other babies, and they thought there's something different about this pregnancy. Sometimes, particularly with boys, because boys often have that hyperactive type, you can notice it very, very, very early. It does improve for some people over time because their brain completely finishes developing. By the time you're 23, your brain is not fully developed. So it takes that long to really see, you know, improvements. But usually, as a rule of thumb, by the third grade, in the
Mm.
third grade is when you should have seen some symptoms of ADHD if the person's going to have it. And let me just quickly say there's a very big, big, big exception to this rule, and that is girls and women. Girls and women are still underdiagnosed. And they're underdiagnosed for lots and lots of reasons. One reason is because girls and women often have inattentive type. So they're sitting quietly in the classroom, daydreaming, not paying attention, but because they're not being disruptive, nobody notices.
Mm.
The other thing that happens, I think, culturally, and this is a very sexist part of our culture, I think girls are taught to behave and are told they need to be quiet and demure and comply. And so girls with ADHD often learn how to mask their symptoms so that they can fit in and that they can be accepted. Whereas boys are kind of given a pass. Boys have that boys will be boys thing. And when they act up and they're disruptive and hyperactive, nobody freaks out. They kind of like roll with it. So women often don't get diagnosed as children. The average age of diagnosis for a woman in this country is 37, which is unbelievable. And I'll tell you
Wow.
why. One thing you mentioned at the top of the show was social media. Social media has changed everything about people's awareness. And because a lot of social media involves women, they're learning and they're putting the pieces together. In my medical practice, I can tell you how it happens that an older woman gets diagnosed. She comes in with her third grader, and I'm asking all these questions about his or her behavior. And all of a sudden, bing, this light bulb goes off in the mother's head, and she realizes, wait a minute, that sounds a lot like me. And often a parent will find out that they have ADHD too.
Wow. I don't know if you've ever experienced this or how much you would know about it, because you talked about kids in, third grade and parents bringing their kid to the doctor. Have you run into parents who don't want to accept that their kid has a particular like ADHD or, because I think that there might be someone listening where maybe they were told by the doctor, there's nothing wrong with my kid. He just wants to have fun. And she's just like this. How do you get a parent to accept it without being defensive? Because I think that's a really important thing.
All the time that happens. And it's embarrassing that it doesn't just happen with parents. There are a whole lot of doctors out there. who will dismiss patients and tell them they don't have ADHD because they did well in school, or they don't have ADHD because they finished college. None of that's true. All of those are myths. So, what I try to do is, without being defensive, do education, talk about brain development, talk about genetics, describe the symptoms in a way that people can appreciate it as an explanation, that ADHD is an explanation for how someone behaves, not just seen as an excuse. Because I think a lot of people will say ADHD is being used as an excuse for you being lazy or you're not doing your homework or whatever else it is. But while I use those words, lazy and not doing your homework, I want to point something out. I think what gets in the way of people with ADHD's ability to trust and believe in themselves is all the negative self talk that they have developed. By the time a kid with ADHD reaches 12 years of age, they have already heard 20,000 negative comments about themselves.
That's
20,000 by the time
oh,
they're 12. You're so noisy. You're so messy. Why can't you remember to pick up your, it's constant. 20,000 negative comments is going to eat at your self esteem. And when you're a little kid, you believe it's your fault. So
mm,
all of that negativity becomes personalized and internalized, and it develops into constant negative self talk. Where an adult with ADHD will say things like, I'm so lazy and I'm so stupid. And, I can never be successful. I can never do anything right. When I think about how to help people with ADHD, Shaun, medicine is often not the first thing I think of, even though it can be very beneficial. The first thing I think of is helping people learn how to change the way they think about their ADHD and change the way they think about themselves. Because when you shift and you're able to change how you think about yourself, instead of saying, why am I so lazy? You might ask, what's another way that I can do this? Or it just shifts everything into a solution focused orientation rather than just focusing on the problem.
I was watching this YouTube video on this gentleman from the UK who won America's Got Talent. His voice was absolutely incredible. And one of the judges says, what happens if you don't win, or what happens if you mess up? And I was floored when he said, I never thought that. I literally was in my car and I started crying because I'm like, I spent so much of my life focusing on the negative because of my negative childhood. And I'm looking at this man and I'm like, holy crap. Like, how amazing is it to be about to step on stage in front of thousands of people and millions of people who are watching and be able to say, well, I actually never thought about the fact that I wouldn't win. Not in a cocky way, but just because of, I'm sure he was filled with so much like positivity and love and joy and being able to work through his emotions. So I just like that you brought that up to help parents out there, or even, when it comes to negative self-talk.
Yeah.
Like, one of the best ways to believe in yourself is to talk really great to yourself. And like you said earlier, it will help you behave differently.
I think something has happened. Um, Maybe social media too. Positivity somehow got tossed out with toxic positivity. And so
Mhm.
people got so focused on don't have toxic positivity that they stopped being positive. Toxic positivity is when everything that happens to you, somehow you see it in a wonderful way. It's that expression that I hate when something bad happens and somebody said, oh, it's okay, it's all good. No, it isn't.
It's
It is
not.
not all good. Stop that. But it doesn't mean that you have to continue to suffer. The truth is, pain is going to happen to most of us. Some
Mm.
people experience more pain than others. But it doesn't mean you have to let that pain sit inside of your body and steep like a tea bag until the tea is so strong it makes you sick.
Mm.
Pain is inevitable, but misery is optional.
Mm. You should put that on a t-shirt or a sweatshirt. That's yeah. Misery is optional. So I'm gonna challenge that for a second. For
Sure.
someone who says, well, this happened to me. And I don't think that way now, but I'm going to just say it as if I were to say it. I'm like, well, I'm in misery because I was sexually abused from the time I was 8 to the time I was 12. And, my mother didn't have money. And so I grew up in misery. So why is it an option for me when that's the only thing I've known?
It's true. And, that's often where people start in therapy. I'm a child psychiatrist. I see a lot of teenagers, and they want to throw their parents under the bus, or they've had some really, really horribly bad experiences. And often I'll say to them, okay, so now we know whose fault it is. What would you like to do next? Because it's true. Something
The
horrible
gag.
happened. I mean, if you're sexually traumatized, something horrible happened to you, but we cannot go backwards. And so that is what anxiety is. Anxiety is when you take a field trip. You either take a field trip back and re experience something awful and bring that awfulness into today, or you take a field trip into the future and imagine something horrible that hasn't happened. Both of those field trips make you feel like shit now, but now none of those things are happening.
Right. That is so powerful because that is what anxiety does. Like it's literally a fantasy. And most of the time the anxiety is creating a fantasy of like trauma.
Mhm.
You're creating
It's
this
true.
trauma that doesn't exist. I had a friend who is a nurse practitioner, and I say, what do you say to patients who are like waiting for test results, or they're waiting for some sort of diagnosis, or they came to the emergency room and like, how bad is it going to be? And she says, I just tell them, don't panic until you have to. You're panicking about something that doesn't even exist or you didn't find out yet, which is really hard for a brain of a person who, obviously suffers that way. But it
Sure.
definitely resonated with me really well as somebody who, definitely has a history of suffering from anxiety and
Sure.
creating these narratives that literally doesn't exist. And my husband would be like, when I would be in those moments of really stressed out, he would be like, what are the facts? Like,
Right.
what facts do you know now?
100%. Anxiety is fiction, and the cure for anxiety is fact. Every single time. Well, and that's not true. Some anxiety is good, like learning when you're cooking not to touch a hot stove, pay attention,
Yeah.
that kind of thing. Some anxiety prepares us and keeps us safe, but most anxiety is fiction, and facts will change it. And a lot of anxious people, I bet if I use these two words, you're going to smile. Most people who have anxiety start lots of their thoughts with the words, what if? What if
Okay,
this
you got
happens?
me.
What if that happens? What if this happens? So, what I offer people as a cure for what if are the two words, even if. Even if this bad
Mm.
thing happens, I'll figure it out. Even
Sure.
if this bad illness occurs, I still get better. So it changes you into a more positive, solution focused orientation instead of this big, hypothetical, horrible what if that just makes you feel bad.
Yeah, because it's literally taking you down a road to destruction.
Right. And we think it's making us be safe, but it doesn't help you be safe because you probably are preparing for something that's never going to happen. Or by the time something does happen, you prepare for the wrong
Exactly.
thing.
And you wasted time preparing for a test that's not even going to be on your desk. I kind of want to circle back to your ADHD experience. What is your coming of age story when it comes to ADHD?
Well, I was an adult before I put the pieces together that my overachievement and perfectionism, etc., was probably masking for inattentive type ADHD. So it wasn't until I was a professional that I figured it out. It was not a part of my childhood. In my childhood, I grew up in this Greek American family where education was the priority number one, number two, number 50, and I was going to be good. I was going to be a good student. Period. End of story. So, and I was going to be successful. I didn't figure it out and put the pieces together until much, much later in life. That's my coming out story.
Yeah. I love that. What was your process like once you figured it out? Did you have any like residuals from when you were younger, or were you like, I'm just going to be action oriented? Like, how did you
I
manage
still
that?
have residuals. Come on, we all have, I still have that. I think what I learned most is I don't have to be perfect. I'm throwing a dinner party for my friends. Even if it flops, they still love me. It's like I had to get beyond that. I have to be perfect or else bad things will happen because that's a kind of anxiety, right? And what I've really come to, and what I talk about myself, what I talk about on my Instagram feed, what I talk about with my patients is more powerful than medicine and any hack or tip that you will hear is learn to practice self compassion. And not just self compassion when you get it right, meaning be compassionate toward yourself when you're having the worst day, when you're doing your poorest job. Think about
Mm.
what you would say to someone else.
Yeah, because usually if someone comes to you for advice, you have usually the most uplifting or logical answer, but to yourself, you're not really that. It doesn't flow off your tongue that easily.
So, self compassion is a really powerful, and important practice. It really means having a few phrases in mind that you say to yourself at those times. Be ready. If you notice you're beating yourself up, be ready. Sometimes I tell my patients to use an SOS. What
Mm.
SOS, save our ship or save our soul. Well, I use SOS to stand for this little memory device. The first S stands for stop. The O stands for one thing. What's the one thing that you can say right now to make yourself feel better? And the next S is start over. Stop,
Mm.
say that one thing and start over. But you kind of have to be prepared. It works better if you're someone who always said, I'm so lazy or I'm so stupid. Instead, if you would have, I graduated from medical school, in mind, so that when you're beating yourself up, you have a factual statement to start over with.
There are people who hear about mental health, or they hear about, oh, you should go get therapy or seek out therapy, and they think it's kind of like foo-foo. This is my mission of 2023, to talk about mental health so much, and every time I come out of therapy, give a thing that I learned about myself to get people to just be open to the idea. So I'm asking you as a therapist, what are some things we can do to reach these people without being like a missionary?
Okay.
you know
Again, for me, it's a little bit of education, but I like to educate people with stories. I often tell a story about our emotions. We have two kind of emotions: the comfortable emotions and the uncomfortable emotions. Notice I didn't say the good ones and the bad ones. I didn't
Mm.
say the right ones and the wrong ones. I said the comfortable ones and the uncomfortable ones, and they're all normal. The reason why a lot of people won't go to therapy or try to call it something negative to try to make an excuse for not going to therapy is because they're afraid that it's going to hurt. And my answer is it is going to hurt. It's going to hurt exactly like soreness when you work out in the gym. I mean, you're in the fitness industry. So when you help somebody the next day, their muscles are going to be sore. And usually people celebrate that soreness because it means they exercise that muscle's going to get stronger. So in therapy, when you feel uncomfortable, your therapist or your personal trainer is going to ask you questions and help you do things that are going to make you uncomfortable. But they're not going to ask you to do things that are dangerous or that are
Mm.
harmful any more than your trainer is going to ask you to lift 125 pounds if you're only ready to lift 15.
That's really good, because I think that you're like, I know. You can say I know, Perry. You can say I know. You
Shaun,
can say I
listen,
know.
I've been telling these stories a long time, my man. So I do know these stories reach people.
Yes, I love that. I was thinking of a couple different things, which is why I had the long pause. I was thinking of I'm training and prepping to do my first physique competition. So it's, I'm building muscle and it's a whole process. I have a trainer and a coach, but sometimes, I'm working out with them and I'm like in my head, I'm like there is no way. There's no way I'm lifting that weight. And then when we get past the number of reps in which I feel like I'm already about to be keeled over and they're like you got 5 more, in my head, I'm like, who the are you talking to? Like, what? And then I get it and I finish it. And part of me is like, how did you know I could finish that? I don't ask them that question because they know I can. They didn't do anything to injure me. And I just think that's like such a good thing for people out there because I mean, I know people who are in a most respectful way, much older than me, that are still acting out. They're responding to the trauma from a very young age. And they have told me, I don't want to relive that. I would only say, well, it'd be really hard to get better without trying to deal with it. But I think that they do have that fear of thinking is dangerous. Like,
Right.
when my trainer says I have to lift this, I'm like, okay, like my shoulder's not going to pop out from lifting this. They're smarter than that. And it's, for people out there, it's like,
Yeah.
yeah, it's going to be uncomfortable. It's going to be uncomfortable, but it's not going to be as dangerous as the thing that got you to this state.
Exactly. When you ask someone to get out of their comfort zone, sometimes they'll give you an answer like you have to take risks, you have to try new things. When you ask someone to get out of their comfort zone, you're asking them to be uncomfortable. It doesn't mean they have to experience something that is unbearable. It doesn't mean they have to experience something that's dangerous, but they do have to sit with some discomfort. And when you do it, it's not uncomfortable anymore. So it's really just like physical training in the gym. Eventually that weight is not going to make your muscles feel sore, and then you'll lift more weight. And so your comfort zone just keeps getting bigger and bigger because you get better and better at learning about your uncomfortable emotions, learning how to manage them. You know, um, I try to help people understand, feel all the feelings, including the uncomfortable ones. But the uncomfortable ones are the ones that require some skill. Nobody rejects their comfort. Well, not some people, but most people don't reject their comfortable feelings. So it's the uncomfortable feelings that take some skill, and you have to feel them first and then move on.
Something you said, which is a good thing for people to hear, if they are having the fear because of the words get uncomfortable, I think it's just saying, well, grow your comfort zone.
Yeah,
It's just, I think that's it. It's
totally.
just, okay. It's even like you, like 6 months into your experience of being in a hospital. You said there's two kinds of people who, kind of thrive in it and people who kind of stay in that space. Is people who are thriving in it and that life change is growing their comfort zone
Totally.
because it's really, as I think about it and process it, it's really the way forward, literally.
Exactly.
And it's
Literally.
just like,
And the thing is, though, you don't, a lot of people reject therapy because they say, well, my life isn't that bad, or my circumstances aren't as bad as someone else's. And what I say to them is, have you ever noticed how many coaches Olympic athletes travel with? Why does an Olympic athlete who arguably is the best in the world at their sport, why do they need a bus full of coaches? Because those people are there to help them get just a little bit better, just a little something new that they can do. And so sometimes if you have an issue in your life, it doesn't have to be as bad as someone else's. It may not be trauma, but you could still talk it through with a therapist who can show ways to improve it.
when people who are either starting out their fitness journey or they want to start out their fitness journey or they aren't doing any fitness at all, and then you offer them like, hey, come work out with me or come to, and they're like, oh, it's easy for you. And I'm like, it's hard for me every day, but the risk, not the risk, but the result of the work is the joy. And that's the joy you see, and you can too. All right. So I think I have two more things, if that's okay.
Sure.
What are the things you wish everybody knew, but maybe don't yet, to help people with ADHD trust and believe in themselves? That's my second to last question, because I just think it's like so powerful.
First of all, I wish people would just accept that ADHD is real. This may be unpopular for me to say out loud in the neurodivergent community, but ADHD stands for Attention Deficit Hyperactivity Disorder. And the neurodivergent community is trying to get rid of the word disorder to turn ADHD into a superpower. That's all well and good on social media, but I know that there are a lot of people who are not on social media who have become suicidal. People with ADHD have a 6 times greater chance of taking their own life than someone else, who have developed chemical addictions 10 times greater, who have dropped out of school 2 times more often, who have gotten divorced 4 times more often. So ADHD is very disabling for some people. Um, and so when I hear people go, well, it's just that my brain is different. Yes, it's true, but it's not different like brown eyes are different from blue eyes. It's more like different from normal vision and nearsightedness. And thankfully, we can put our glasses on and fix nearsightedness. So you don't have to continue to be nearsighted. You can learn to see differently. You can learn to see a new way. And here's what happens with people with ADHD: they develop some superpowers. ADHD itself, I will never call a superpower. But what happens is they develop superpowers. So they are very resilient people because they have been knocked down so many times and they have learned how to get back up.
I think you developed superpowers because you do the work.
Absolutely. That's right. You know, when I first had my spinal cord injury and I was in a spinal cord injury hospital, they put all the people who are new to being in a wheelchair in group therapy together. And one of the first things the group therapist said to us was, if you are not a flexible and adaptable person before now, today would be a good day to develop those skills.
Mm.
And so anytime you are born with something that's different that will challenge you in some way, or something happens to you that's going to challenge you in some way, being flexible and adaptable is the way through.
I'm just like sitting in that for a second. My last question, unfortunately, I feel like I can talk to you for an entire another hour. How can people find you? And do you do like online therapy for people who may want to reach out to you? Or
You know, I get that a lot. I don't do any online therapy because medical doctors are held to a different standard in terms of malpractice insurance and medical licensing. So I can only see people if they're in the Connecticut area. So anybody from Massachusetts, Connecticut, Rhode Island, they do drive in to see me. What I do offer online is coaching, very specific ADHD coaching, where we talk about your ADHD and what your goals are and what your struggles are and what your talents are and leverage them to help you meet your objectives and your goals. So I do a lot of online coaching. People can find me on Instagram at Perry, like Perry Ellis, .mandanis.md.
thank you so much. This was wonderful and positively selfish for me. It was very wonderful. I loved being able to process things as you were speaking and really relating it to my own life. And I think I say that because a lot of people, you know, I'm on social media, and again, social media is a snapshot into people's lives. You know, I think my podcast is a better place for people to get to know me because I get to be moved and conversate and share a little bit more that's deeper, so people can obviously get that. But I think that if you're just watching people on social media, even if they do have ADHD or they're struggling with something, a lot of times it's turned into like you said, it's turned into like this is a superpower, and it's not. And we need to allow people to really feel those emotions so that they can feel the emotions and not feel less than, because other people out there are making it like it's so easy to overcome this, and really celebrate the work that people are doing. So I just know that people hearing your personal stories through here, and obviously being able to allow me to talk about some of my struggles as well, they will be moved and motivated. So thank you so much for your time.
Thank you for having me on, Shaun, and for giving me the time to spotlight ADHD with you. Thanks.
Thank you.